Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 25 practice NCLEX questions. Without the way, let's get started.
A client is becoming agitated during a discussion group. She states, "I know that all of you hate me." She leaves the group and goes to her room. Which action by the nurse is most therapeutic for the client? 1. After group, ask the client to talk to the nurse about her concerns. 2. Ask the client to return to group and share her feelings. 3. Explain to group members about the client's problems. 4. Ask the group members to apologize to the client individually. The correct answer is 1. It is appropriate to talk alone with this client about her feelings. A suspicious client is unlikely to agree to talk about feelings in a group. It is a violation of the client's privacy to reveal a client's problems to group members. The other clients in the group have no reason to apologize, and the nurse should not ask them to do so. A client is receiving haloperidol decanoate. He has stiff muscles, restlessness, and internal jumpiness. The client has all of the following medications prescribed as needed. Which one will be most appropriate for the nurse to administer to decrease the client's symptoms? 1. Lorazepam. 2. Benztropine mesylate. 3. Trazodone. 4. Olanzapine. The correct answer is 2. The reported symptoms are signs of extrapyramidal side effects. The medication of choice is benztropine, an anti-Parkinson medicine. Lorazepam is an anti-anxiety agent. Trazodone is an antidepressant used to enhance sleep. Olanzapine is an antipsychotic medication that could aggravate the extrapyramidal side effects. A client states that she hears God's voice telling her that she has sinned and needs to punish herself. Which response by the nurse is most important? 1. How do you think you'll be punished? 2. Please tell staff when you think you need to punish yourself. 3. What exactly do you think you have done to be punished? 4. Let's talk about your strengths. The correct answer is 2. The client is at risk for harming herself because of the command auditory hallucinations. It is most important for the staff to know if she currently thinks she needs to punish herself. Then it is important to know how she thinks she might punish herself. Knowing what she thinks she has done is relevant for changing her negative thinking. Focusing on her strengths will help improve her self-esteem. When preparing the teaching plan for a client who is to start clozapine, which of the following is crucial to include? 1. Description of akathisia and drug-induced Parkinsonism. 2. Measures to relieve episodes of diarrhea. 3. The importance of reporting insomnia. 4. An emphasis on the need for weekly blood tests. The correct answer is 4. Clozapine is associated with agranulocytosis. Therefore, the nurse must instruct the client about the need for weekly blood tests to monitor for this adverse effect. Akathisia and drug-induced Parkinsonism are associated with high-potency antipsychotics. These effects are not common with this atypical antipsychotic agent. Constipation and sedation may occur with this drug. In a family education group for those who have relatives with paranoid schizophrenia, which of the following comments indicates the need for further teaching about symptom management? 1. When the clients get overwhelmed, it's best that they spend some time in their room. 2. The more we push the clients to spend time with friends, the more their voices decrease. 3. Until we get the clients up and going, they seem to have no motivation to do anything. 4. We still have to remind the clients that we don't hear the voices they do. The correct answer is 2. Pushing a suspicious client into social situations is likely to increase anxiety, which increases, not decreases, the hallucinations. The statement about spending some time alone if the client is overwhelmed indicates awareness and understanding of how to intervene when the client is exposed to stress. The statement about lack of motivation indicates awareness and understanding of avolition. The statement about reminding the client that the family doesn't hear the voices indicate awareness and understanding of the client's hallucinations. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. The nurse is assessing a client who is taking an antipsychotic medication. Which of the following symptoms is uniquely indicative of neuroleptic malignant syndrome NMS and requires immediate attention? 1. Very high temperature. 2. Muscular rigidity. 3. Tremors. 4. Altered consciousness. The correct answer is 1. Muscular rigidity, tremors, and altered consciousness are symptoms of other movement disorders as well as NMS, such as extrapyramidal side effects. High temperature is unique to NMS, particularly when seen with the other 3 symptoms. NMS is potentially fatal and needs immediate attention. Which of the following sets of conditions is an indication that a client with a history of left side heart failure is developing pulmonary edema? Select all that apply. 1. Distended jugular veins. 2. Dependent edema. 3. Anorexia. 4. Coarse crackles. 5. Tachycardia. The correct answers are 4 and 5. Signs of pulmonary edema are identical to those of acute heart failure. Signs and symptoms are generally apparent in the respiratory system and include coarse crackles, severe dyspnea, and tachypnea. Severe tachycardia occurs due to sympathetic stimulation in the presence of hypoxemia. Blood pressure may be decreased or elevated, depending on the severity of the edema. Jugular vein distension, dependent edema, and anorexia are symptoms of right-sided heart failure. What is the rationale that supports multi-drug treatment for clients with tuberculosis? 1. Multiple drugs potentiate the drug's actions. 2. Multiple drugs reduce undesirable drug adverse effects. 3. Multiple drugs allow reduced drug dosages to be given. 4. Multiple drugs reduce development of resistant strains of the bacteria. The correct answer is 4. Use of a combination of anti-tuberculosis drugs slows the rate at which organisms develop drug resistance. Combination therapy also appears to be more effective than single drug therapy. Many drugs potentiate or inhibit the actions of other drugs. However, this is not the rationale for using multiple drugs to treat tuberculosis. Treatment with multiple drugs does not reduce adverse effects and may expose the client to more adverse effects. Combination therapy may allow some medications to be given in reduced dosages. However, reduced dosages are not prescribed for antibiotics and anti-tuberculosis drugs. The nurse is instructing a client with chronic obstructive pulmonary disease how to do pursed lip breathing. In which order should the nurse explain the steps to the client? 1. Breathe in normally through your nose for 2 counts. 2. Relax your neck and shoulder muscles. 3. Pucker your lips as if you're going to whistle. 4. Breathe out slowly through pursed lips for 4 counts. The correct order is 2, 1, 3, and 4. The nurse should first instruct the client to relax the neck and the shoulders and then take several normal breaths. After taking a breath in, the client should pucker the lips and finally breathe out through pursed lips. The nurse should assess the client for digoxin toxicity if serum levels indicate that the client has a 1. Low sodium level. 2. High glucose level. 3. High calcium level. 4. Low potassium level. The correct answer is 4. A low serum potassium level predisposes a client to digoxin toxicity. Because potassium inhibits cardiac excitability, a low serum potassium level would mean that the client will be prone to increased cardiac excitability. Sodium, glucose, and calcium levels do not affect digoxin or contribute to digoxin toxicity. Clients who have had active tuberculosis are at risk for recurrence. Which of the following conditions increases that risk? 1. Cool and damp weather. 2. Active exercise and exertion. 3. Physical and emotional stress. 4. Rest and inactivity. The correct answer is 3. Tuberculosis can be controlled but never completely eradicated from the body. Periods of intense physical or emotional stress increase the likelihood of recurrence. Clients should be taught to recognize the signs and symptoms of a potential recurrence. Weather and activity levels are not related to recurrences of tuberculosis. When teaching a client with chronic obstructive pulmonary disease to conserve energy, the nurse should teach the client to lift objects. 1. While inhaling through an open mouth. 2. While exhaling through pursed lips. 3. After exhaling but before inhaling. 4. While taking a deep breath and holding it. The correct answer is 2. Exhaling requires less energy than inhaling. Therefore, lifting while exhaling saves energy and reduces perceived dyspnea. Pursing the lips prolongs exhalation and provides the client with more control over breathing. Lifting after exhaling, but before inhaling, is similar to lifting with the breath held. This should not be recommended because it is similar to the Valsalva maneuver, which can stimulate cardiac arrhythmias. Which is the most important initial post-procedure nursing assessment for a client who has had a cardiac catheterization? 1. Monitor the laboratory values. 2. Observe neurologic function every 15 minutes. 3. Observe the puncture site for swelling and bleeding. 4. Monitor skin warmth and turgor. The correct answer is 3. Assessment of circulatory status, including observation of the puncture site, is of primary importance after a cardiac catheterization. Laboratory values and skin warmth and turgor are important to monitor, but are not the most important initial nursing assessment. Neurologic assessment every 15 minutes is not required. 12 hours after cardiac surgery, the nurse is assessing a 3-year-old who weighs 15 kilograms. The nurse should notify the surgeon about which of the following clinical findings? 1. A urine output of 60 milliliters in 4 hours. 2. Strong peripheral pulses in all 4 extremities. 3. Fluctuations of fluid in the collection chamber of the chest drainage system. 4. Alterations in levels of consciousness. The correct answer is 4. Clinical signs of low cardiac output and poor tissue perfusion include pale, cool extremities, cyanosis or mottled skin, delayed capillary refill, weak, thready pulses, oliguria, and alterations in level of consciousness. An adequate urine output for a child over 1 year should be 1 milliliter per kilogram per hour. Therefore, 60 milliliters per 4 hours is satisfactory. Strong peripheral pulses indicate adequate cardiac output. Drainage from the chest tube should show fluctuation in the drainage compartment of the chest drainage system. The fluid level normally fluctuates as proof that the apparatus is airtight. On about the 3rd postoperative day, the fluctuation ceases, indicating the lungs have fully expanded. A client with acute asthma is prescribed short-term corticosteroid therapy. Which is the expected outcome for the use of steroids in clients with asthma? 1. Promote bronchodilation. 2. Act as an expectorant. 3. Have an anti-inflammatory effect. 4. Prevent development of respiratory infections. The correct answer is 3. Corticosteroids have an anti-inflammatory effect and act to decrease edema in the bronchial airways and decrease mucus secretion. Corticosteroids do not have a bronchodilator effect, act as expectorants, or prevent respiratory infections. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Before a client's discharge after mitral valve replacement surgery, the nurse should evaluate the client's understanding of post-surgery activity restrictions. Which of the following should the client not engage in until after the 1-month post-discharge appointment with the surgeon? 1. Showering. 2. Lifting anything heavier than 10 pounds. 3. A program of gradually progressive walking. 4. Light housework. The correct answer is 2. Most cardiac surgical clients have median sternotomy incisions, which take about 3 months to heal. Measures that promote healing include avoiding heavy lifting, performing muscle reconditioning exercises, and using caution when driving. Showering or bathing is allowed as long as the incision is well approximated with no open areas or drainage. Activities should be gradually resumed on discharge. A laboring client with preeclampsia is prescribed magnesium sulfate 2 grams per hour IV piggyback. The pharmacy sends the IV to the unit, labeled magnesium sulfate 20 grams per 500 milliliters normal saline, to deliver the correct dose. The nurse should set the pump to deliver how many milliliters per hour? Blank ml. The correct answer is 50 milliliters. You set up the formula as 500 milliliters over 20 grams multiply by x over 2 grams. You cross-multiply and get 1,000 equals 20x. You divide 1,000 on both sides and you get x equals 50. The nurse is caring for a client who has asthma. The nurse should conduct a focus assessment to detect which of the following? 1. Increased forced expiratory volume. 2. Normal breath sounds. 3. Inspiratory and expiratory wheezing. 4. Morning headaches. The correct answer is 3. The hallmark signs of asthma are chest tightness, audible wheezing, and coughing. Inspiratory and expiratory wheezing is the result of bronchoconstriction. Even between exacerbations, there may be some soft wheezing, so a finding of normal breath sounds will be expected in the absence of asthma. The expected finding is decreased forced expiratory volume due to bronchoconstriction. Morning headaches are found in more advanced cases of COPD signal nocturnal hypercapnia or hypoxemia. A client has just returned from the post-anesthesia care unit after undergoing a laryngectomy. Which of the following interventions should the nurse include in the plan of care? 1. Maintain the head of the bed at 30 to 40 degrees. 2. Teach the client how to use esophageal speech. 3. Initiate small feedings of soft foods. 4. Irrigate drainage tubes as needed. The correct answer is 1. Immediately after surgery, the client should be maintained in position with the head of the bed elevated 30 to 40 degrees to decrease tissue edema, facilitate breathing, and decrease pain related to edema formation. Immediately post-operatively, the client should be provided alternative means of communicating, such as a communication board. As healing progresses and edema subsides, a speech therapist should work with the client to explore various voice restoration options, such as the use of a voice prosthesis, electrolarynx, artificial larynx, or esophageal speech. Food is not initiated in the immediate postoperative phase. Enteral feedings are usually used to meet nutritional needs until edema subsides. Irrigation of the drainage tubes is an inappropriate action. When preparing the room for admission of a multigravida client at 36 weeks gestation diagnosed with severe preeclampsia, which of the following should the nurse obtain? 1. Oxytocin infusion solution. 2. Disposable tongue blades. 3. Portable ultrasound machine. 4. Padding for the side rails. The correct answer is 4. The client with severe preeclampsia may develop eclampsia, which is characterized by seizures. The client needs a darkened, quiet room and side rails with thick padding. This helps decrease the potential for injury should a seizure occur. Airways, suction machine, and oxygen also should be available. If the client is to undergo induction of labor, oxytocin infusion solution can be obtained at a later time. Tongue blades are not necessary. However, the emergency cart should be placed nearby in case the client experiences a seizure. The ultrasound machine may be used at a later point to provide information about the fetus. In many hospitals, the client with severe preeclampsia is admitted to the labor area, where she and the fetus can be closely monitored. The safety of the client and her fetus is the priority. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client with bacterial pneumonia is to be started on IV antibiotics. Which of the following diagnostic tests must be completed before antibiotic therapy begins? 1. Urinalysis. 2. Sputum culture. 3. Chest radiograph. 4. Red blood cell count. The correct answer is 2. A sputum specimen is obtained for culture to determine the causative organism. After the organism is identified, an appropriate antibiotic can be prescribed. Beginning antibiotic therapy before obtaining the sputum specimen may alter the results of the test. Urinalysis, a chest radiograph, and a red blood cell count do not need to be obtained before initiation of antibiotic therapy for pneumonia. The cyanosis that accompanies bacterial pneumonia is primarily caused by which of the following? 1. Decreased cardiac output. 2. Pleural effusion. 3. Inadequate peripheral circulation. 4. Decreased oxygenation of the blood. The correct answer is 4. A client with pneumonia has less lung surface available for the diffusion of gases because of the inflammatory pulmonary response that creates lung exudate and results in reduced oxygenation of the blood. The client becomes cyanotic because blood is not adequately oxygenated in the lungs before it enters the peripheral circulation. Decreased cardiac output may be a comorbid condition in some clients with pneumonia. However, it is not the cause of cyanosis. Pleural effusions are a potential complication of pneumonia, but are not the primary cause of decreased oxygenation. Inadequate peripheral circulation is also not the cause of the cyanosis that develops with bacterial pneumonia. The client with pneumonia develops mild constipation, and the nurse administers docusate sodium as prescribed. This drug works by 1. Softening the stool. 2. Lubricating the stool. 3. Increasing stool bulk. 4. Stimulating peristalsis. The correct answer is 1. Docusate sodium is a stool softener that allows fluid and fatty substances to enter the stool and soften it. Docusate sodium does not lubricate the stool, increase stool bulk, or stimulate peristalsis. After a tonsillectomy and adenodectomy, which the following findings should alert the nurse to suspect early hemorrhage in a 5-year-old child. 1. Drooling of bright red secretions. 2. Pulse rate of 95 beats per minute. 3. Vomiting of 25 milliliters of dark brown emesis. 4. Blood pressure of 95/56. The correct answer is 1. After a tonsillectomy and adenodectomy, drooling bright red blood is considered an early sign of hemorrhage. Often, because of discomfort in the throat, children tend to avoid swallowing. Instead, they drool. Frequent swallowing would also be an indication of hemorrhage because the child attempts to clear the airway of blood by swallowing. Secretions may be slightly blood-tinged because of a small amount of oozing after surgery. However, bright red secretions indicate bleeding. A pulse rate of 95 beats per minute is within the normal range for a 5-year-old child, as is a blood pressure of 95/56. A small amount of blood that is partially digested and therefore dark brown is often present in postoperative emesis. After insertion of bilateral tympanostomy tubes in a toddler, which of the following instructions should the nurse include in the child's discharge plan for the parents? 1. Insert earplugs into the canals when the child bathes. 2. Blow the nose forcibly during a cold. 3. Administer the prescribed antibiotic while the tubes are in place. 4. Disregard any drainage from the ear after 1 week. The correct answer is 1. Placing earplugs in the ears will prevent contaminated bathwater from entering the middle ear through the tympanostomy tube and causing an infection. Blowing the nose forcibly during a cold causes organisms to ascend to the eustachian tube, possibly leading to otitis media. It is not necessary to administer antibiotics continuously to a child with a tympanostomy tube. Antibiotics are appropriate only when an ear infection is present. Drainage from the ear may be a sign of middle ear infection and should be reported to the healthcare provider. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.